November is Alzheimer's Awareness Month. The National Institute of Health estimates more than 6 million Americans have dementia caused by Alzheimer's. And Alzheimer's disease is currently ranked as the 7th leading cause of death here in the United States. Joining us now is Dr. Alfredo Rivera. He is a psychiatrist at the HealthONE Behavioral Health and Wellness Center. We appreciate your time today.
Oh, thank you for having me.
Well, you know, Alzheimer's is such a devastating disease, and many families feel hopeless when they get that diagnosis. Are there early ways to catch this?
Yes. We understand that the disease may occur as early as 20 years before it actually produces clinical symptoms enough to warrant or intervene in treatment.
Well, oh, go ahead. Sorry.
Good. Everyone is aware that Alzheimer's is so-called a memory problem, but it's actually a combination of a memory problem and a functional problem. And it all boils down to your cognition, and it'll manifest in ways from your daily activities to more complex activities like driving.
Well, we know the progression of Alzheimer's can be another thing just so hard to cope with. Are there ways to slow down the progression of Alzheimer's after a diagnosis?
Yes, and I strongly encourage you to loop in your physician team. And the slowing down of the progression can occur with medications. Can occur, and as much as I'd love to talk about medications, we have in the past few decades very few medications. None of them actually cure the disease. What I would strongly recommend is focusing on the non-medication ways to intervene in Alzheimer's.
And we know most people are familiar with the cognitive impacts of Alzheimer's, like how it affects your memory. But you kind of mentioned this. There's another part of this that can affect the person's behavior. What are some of those impacts?
Remember, when regards to Alzheimer's, it's one of those illnesses that a lot of people don't know they have. And it's because of the 20 years before. But since it affects your cognition, it can affect your insight. So I do believe that things like what you used to be able to do and can't do can be seen by loved ones and people who you know.
And finally, let's just circle back. You mentioned medication's one way to treat it. What are some of the other ways you kind of alluded to?
The word in treatment is team. It's not you and your loved one. Your loved one has to utilize factors like your physician, the Alzheimer's Association, loved ones to take care and take their turn in taking care of the loved one, because once this occurs, is a 24-hour, 7-day-a-week management of problems.
Well, Dr. Rivera, thanks so much for joining us today. We really appreciate your time, so thank you.
Oh, thank you very much.
All right, don't forget, you can always find all of our health interviews right now on cbscolorado.com.